What is the diagonal 2 pattern for upper extremity flexion ending position? The answer is flexion, abduction, and internal rotation. Which of the following is a contraindication to implementing resistance exercise? The answer is acute pain or inflammation. It has been shown that after performing resistance exercise to the point of exhaustion, recovery from fatigue occurs most efficiently if the answer is the patient performs low-intensity active exercise using the fatigued muscle. When applying a stretch, you first feel some resistance. As you maintain the stretch, you feel as though you can move into a greater range using the same amount of force. What mechanical property of connective tissue does this describe? The answer is creep. What is the starting position of a diagonal 1 pattern for upper extremity flexion? The answer is extension, abduction, and internal rotation. Your patient is lying supine and you are strengthening the iliopsoas on the right using manual resistance. What would be the main reason you would want to place the patient's left hip and knee in flexion with the foot planted on the table? The answer is to stabilize the pelvis in neutral to posteriorly rotated position to lessen the possibility of an anterior pelvic tilt occurring, placing stress on the lower back. The PTA is working with a patient who has been in a wrist cast for 8 weeks when the PTA works on stretching to increase this patient's pronation and supination. Where should the PTA stretch force be specifically concentrated on? The answer is radius rotating around the ulna. Within 1 week of beginning resistance exercise of the shoulder external rotators as a component of a rehabilitation program after a shoulder injury, your patient is able to increase the level of resistance by using heavier grade elastic tubing. Which adaptive changes is this improvement of muscle performance primarily due to? The answer is increased recruitment of motor units. A patient is holding a piece of elastic tubing with both hands in front of the body. Both elbows are flexed to 90 degrees and both upper arms are held gently against the sides of the patient's chest. Instruct the patient to internally and externally rotate both shoulders simultaneously in this position. What does this activity strengthen? The answer is external rotators concentrically and eccentrically. During the stretching maneuver, you apply a 30-second stretch of a shortened muscle group just up to the point of tissue resistance. After this maneuver, rather than relaxing with the patient and returning the body segment to a neutral position, you move the body segment into the newly gained range to apply another stretch of the same muscle group and hold the stretch for an additional 30 seconds. What term best describes this type of stretching? The answer is static progressive. The answer is GTO excitatory process. To most effectively use the phenomenon of stretching in a stretching routine. The answer is that the tissues should be warmed, and the force maintained between 15 to 60 seconds. Diagonal patterns cross the midline and incorporate. The answer is abduction, adduction, flexion, extension, internal rotation, and external rotation. You are treating a patient who presents to physical therapy with shortened elbow flexors. This causes him to not be able to fully extend his elbow. What should you document your patient having in your own part of your note? The answer is elbow flexion contracture. A patient had surgery and 8 weeks of rehabilitation for carpal tunnel syndrome. You notice that the patient's Thesar eminence is almost the same size as that of the uninvolved hand. What is causing this adaptive change? The answer is hypertrophy of muscle fibers.